to the Stronger After Stroke podcast. I'm your host, Rosa Hart, and I am the stroke nurse navigator for Norton Healthcare here in Louisville, Kentucky. Today, I'll be introducing you to Kerry Willis, our board-certified music therapist. She is also specially trained in neurologic music therapy, where she practices at the Comprehensive Stroke Center, where we met. And that is at Norton Brownsboro Hospital in Louisville. In addition to her work at the bedside, she also teaches outpatient support classes. So thank you so much for being with me today.
Thank you for having me. I'm excited to be here.
You, I feel like, are one of the hidden treasures that we have on our neuro team. And the part that you play in our care for neuro patients, especially my stroke patients, is not always known. And so I'm really excited to get to share that with people.
Yeah. I'm glad to get to talk about it.
Yeah. So first of all, let's start with, how does music therapy work? Why can somebody's mom sing with you, but they can't talk and say words?
So, one of the really interesting things about music is that it's processed in all different areas of the brain. So when you think about how our brain functions, there's a center that kind of controls our motor movement. There's a center that kind of helps control speech. And while there might be kind of some overlapping areas, there's really like a centralized place for those things. But music has like multiple areas of the brain. So because music is melody, music is words, music is memory, music is emotion. So it's going to be processed in all of those areas of the brain. So when we can't find words, but we can still access music, whether that's singing a melody or recognizing a melody, but we aren't recognizing words, it's because we process that information differently.
It is amazing how everything in the brain is so connected, and then you find little areas that are kind of siloed off, but then you can reconnect them using a different route. It's an amazing little map that we really don't even always understand. What if a patient says when you come in the room, I don't really listen to music, it is not that important to me? How do you respond to that?
I usually say something like, great. So one of the things about music therapy is that you don't have to necessarily like music, or definitely you don't have to be a musician or have any sort of music background to benefit from music therapy, because it just is how our brain functions. So I might talk to the patient or the family, depending, and say, that's fine. There's still going to be music that's familiar. And a lot of my work that I do isn't necessarily focused on performance. We're not going to go out and start a band. We're not going to, go sing at Carnegie Hall. We're talking about using familiar music that's just that we've heard throughout our life.
What would be some examples of songs you might use for that?
So basic songs like Happy Birthday is really popular. Things that nursery rhymes like Row, Row, Row Your Boat. Music, I like to use music from sporting events like Take Me Out to the Ball Game, or the Na 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 song that we like here at the end, the Hey, Hey, Goodbye. So things like that.
Not the national anthem.
No. I mean, while everybody knows and might recognize the national anthem, we don't all know all the words, and it's really hard to sing. So I think, a lot of people might be intimidated by that particular one, unless you're in a stadium full of people.
That's fair. So you said music therapists are not here to perform or entertain. There's always a therapeutic component to your interactions with patients. Sometimes I know you will come into a room with a patient who has been really anxious or confused. So can you tell us how you use music to help patients improve their functionality?
Yeah, so when I see a patient who's anxious or confused, a lot of times what I'm there to do is provide a familiar stimulus. And so finding something, a familiar sound, familiar music, and then also matching the patient's energy, and then gradually adjusting that. So if a patient is really anxious and their heart rate is high, I'm going to try and meet them there and then kind of gradually adjust what I'm playing or the music that I'm using to kind of bring that down. And if it's going to work, it works pretty quickly.
So that's like a form of de-escalation.
Yeah, really.
Wow.
Mhm.
I honestly had not noticed that happening, but now that you say it, you and I worked in the ICU together where I was the bedside nurse and you were the music therapist. I would say, will you come see my anxious patient?
Yeah.
And so I'm thinking back to all those times that you helped calm them down. And it was such a beautiful thing to witness because you weren't trying to convince them of anything. It was just a very personal thing where you're tapping into their emotions.
Right.
And
Right.
so I'm really excited to learn more about that with you here. Music listening after having a stroke. What do you do to help people with music after they've had a stroke specifically?
Okay, so there are several different things that I might do depending on their deficits that the patient has. So, so either helping them, using music that they are familiar with to help them produce sound, to help find words, using music to help them. We'll use music neglect training. So, which is when a patient has, like, say, they have left-sided neglect after a stroke. Using what we know about music, so in the Western world, we have like our set scale, right? C, D, E, F, G, A, B, C. So, I might set up pitched instruments and have the patient, play and getting them to look towards the left. So as the scale progresses, they're looking more and more to the left side. So working on that scanning. And the music and those pitches is what motivates the patient to keep looking because they know that they're not finished yet. So being able to being able to help them navigate that and to look for more. And it really is. It's I'm there to support them, but just that scale helps motivate them. And then when they get to the end, it's like, oh, I accomplished something, Yeah. So let's see.
That can mean a lot to people in the hospital when they're not able to do the things that they normally do. Those of us who really like to have a to-do list and check the boxes so we can feel accomplished if you're stuck laying in a hospital bed because they won't let you get up or because you can't.
Right.
There's not a lot of options for feeling productive. So the completion of those simple tasks can be very rewarding. So.
Yeah. And then we can take that same task and work on dual tasking, like naming the color of the instrument or the note that goes along with the instrument as we go. And can we think of that word and do the task? So, and that can be really complicated for somebody after a stroke, being able to do more than one thing at a time.
Definitely. Can you talk some about how you would use it for delirium?
So I think that probably goes back to the same aspects with what we talked about with the anxious or agitated patient, but also if they're just confused, bringing in that familiar element and really kind of trying to engage them in the moment in the music, irregardless of where they are, so maybe they're not aware that they're in the hospital, but getting them to engage with me so that they can be at least in the moment participating and successful. And then a lot of times that helps to reduce their anxiety or their agitation. They might still not understand that they're in the hospital, but they can relate.
Yes. And then a lot of people, when they're in the hospital, end up getting their days and nights mixed up.
Right.
Due to all of the noises or being awakened frequently, or it's a lot more light than they have at home. And so I've seen you use music therapy to help people reset their body clock.
Yeah. So sometimes making a plan with the family for me to come in the afternoon to make sure that they're stimulated and remain awake until after dinner. I might coordinate something like that. And I also really try to empower the family to use music to set a routine. Maybe to encourage them to, listen to some music in the morning that's going to help wake you up. Listen to some music in the afternoon that's just familiar and fun. Listen to some music in the evening that's relaxing. And it doesn't have to be like an extended playlist. It could be just a couple of songs, but make sure that it's familiar to the patient and try to get them engaged, whether it's, tapping their toes or their fingers, nodding their head, whatever body part that they have control over, trying to encourage them to be focused and present.
So many times when I've had a stroke patient come in and they've been treated with something to fix their stroke, I'm doing all these neuro assessments on them to see if they're regaining that function. Maybe they came in not able to lift their arm or squeeze my hand, but we're hoping that as time goes on, they'll regain that function. And I've had patients who I wasn't able to get them to do the things that I said, but you would come in and play some music and their body would physically respond to the music when they weren't even intending it.
Right.
And so you're very important to our neuro team to elicit responses in areas that will give people hope, where maybe they and their family thought that that arm would never move again, and they see it's possible and they're like, well, how can I get it to do that when I tell it to work? And there was a patient in particular that we were just discussing recently who he played guitar, and you came in and let him hold your guitar and worked with him, and that gave him hope to push through rehab and get better. And now he's playing it independently.
Right. Yeah, exactly. And that particular technique, like using his guitar, so I was using something that was already familiar to him. He knew what it was supposed to look like. He knew what it was supposed to feel like, right? And then that kind of speaks to even that neglect training again, like calling his attention. Look to your left hand. Is that really where it's is it where it's supposed to be? And he was able to like retrain himself to know what it felt like again. So, yeah.
It's so powerful. Music is so powerful, and your devotion to utilizing these techniques strategically is so admirable. A lot of the times I feel like we consider things to be left brain or right brain, and I'm creative, so I'm not so detail oriented, but you have just really wrapped it all up together. And so I really appreciate all of your hard work with these patients and your patience with them.
Thank you. Well, when you talk about like left brain, right brain, creative brain, there was like a recent research study that says that that's where both sides of the brain have creativity. So there's, we're still learning new things about how the brain works and how all the pieces fit together.
See, you're teaching me something else. Every time I talk to you, Kerry, you teach me something. So how can someone listening to this who doesn't live in Louisville and maybe who hasn't had a stroke find a neuromusic therapist?
So all of our affiliate members of the Academy for Neurologic Music Therapy are going to be listed on the Academy website, which should be available in the notes.
It is NMTA, or it's nmtacademy.co/find-an-NMT. It will be in the show notes. and you can find it there.
Yeah.
But you are actually available virtually for anyone who's listening and would like to attend one of your outpatient virtual classes. We have a monthly music and wellness virtual class.
Right.
What do you do in that class?
So that really varies pretty widely. It's for any patient with a neurologic disorder. So a lot of times it depends on who signs up for the class and what I know about them. But we're really focused on ways that we can use music for just maintaining wellness. So we're talking about, the ways that we use our muscles for breathing and for relaxation, the ways that we use our voice so that we are maintaining good vocal quality and breath support, or ways that we can use music to motivate and move our bodies, as well as just the therapeutic aspects of getting together with other people who have had similar experiences and have maybe similar interests. So there's a lot of times there will be a lot of give and take during our virtual sessions.
So that's a good way for people to meet other people in a similar situation, almost like a support group.
Yeah, almost.
Yeah. That's fantastic. Mm-hmm. Well, thank you so much for sharing all this with us today, Kerry. And again, this is Kerry Willis. You can reach out to join the Music and Wellness virtual monthly class or find a music therapist near you on the website in the show notes. Thanks for tuning in to the Stronger After Stroke podcast. Subscribe, and we'll see you in the next episode.